Our next speaker is Lanette Walker, who is the Director of the Youth Services Division for the Ho-Chunk Nation. She'll be discussing programs and initiatives to prevent suicide among Ho-Chunk youth. And while she speaks, it'll be a slideshow from the 2018 Prevent Suicide Conference.
Haini pi, humte e hani chawida hai pi. Hijan kishana hini karagiwi. Ho chunk rajara, ho humchi karenga hingaire. Maikate rajara, Lanette Walker. Hunch, yaki karach wat wanje, pajichie jahachiaje. I just introduced myself to you in my language. I told you where I was from, I told you my English name, and I told you my Ho Chunk name. Ho Humchi Karenga is who I am. That means a flash of light. I come from the Ho Chunk Nation. I am Bear Clan. And for the last 25 years, I've been working with youth in my community back home in Wittenberg. The Ho Chunk name for Wittenberg is Clearing in the Woods. So the pictures that you're seeing up here are from the last event that we did back in September. We had first started doing work in this particular topic back in 2011. And the task was given to us as center directors. There was 8 of us at that time for the Youth Services Division. And we were given the task of coming up with a community action plan on suicide prevention. That was the only thing we were given. And we said, oh, wow, what do we do? We sat on it for maybe a month and we talked about it for a little while. And we finally decided that we didn't know enough. We didn't feel like the experts. We didn't know what we were getting ourselves into. I don't know how many of you feel like that at times, but wow, we just didn't know. We didn't have a clue. We didn't even have a listing of resources that we could, like you see now from all the people and all the programs that are out here now. We didn't have that back then. I think there was maybe 1 or 2 things that were happening in and around our county, but nothing more than that. And so what we decided to do was, first of all, educate ourselves. On your agenda, you see research, analysis, education, and dialogue. So we started educating ourselves, our community, because our community is the smallest of all the Ho-Chunk communities in Wisconsin. And so we didn't have a lot of resources. We're very, very rural. At the time, we didn't even have a McDonald's. Now we have a McDonald's. So that's how rural we were. and so when we started doing the work, we figured out that there was one big barrier. That for us as Ho-Chunk people, and not only Ho-Chunk people, but other Native nations, and even sometimes other religions, that talking about suicide is taboo. You just don't do it. And for the Ho-Chunk people, the traditional people, they're not allowed to talk about death. They do not talk about death. And so we first had to get through that. How do we then have a conversation? If we can't talk about this, then how can we help somebody? How can we understand where this is all coming from? And so when we did that, we had to break down some of that. And when we did, all of the stories just started coming. One of the things we learned right off the bat was that everyone is affected by suicide. It doesn't matter if you've thought about it or if you've attempted it, everyone is touched by this. Not anyone goes untouched. And so when we started doing our work, we started we didn't go out looking for gobs and gobs of money. We didn't want to waste it. So what we did was we talked to our community, and we brought together a lot of people from the community after we started having these conversations. And they all decided, yeah, we need to do something. We need to talk about this. We need to get over that barrier. And so when we did, we were able to bring on our first activity that we did back in 2011. And a young man by the name of Dirk Whitebreast, he had lost his sister to this when she was 18. And he was healing. He turned to drugs and alcohol. He was going down that same path and thinking of those same thoughts. And what he did was he decided to turn his life around. And so he decided to run 10 marathons in 30 days. Anybody here ever done that? Me either. And so we thought we could support him. Our youth decided that we would support him. And so what we did was we got into the Fox Cities Marathon, and we created a relay team out of youth and adults. And so they were out there on the running field supporting one another, so that no one was left alone. We went with him the whole way. Every checkpoint, there was somebody there to greet him, because we wanted him to know that we supported him. And so along the way, it turned into what we have today, which is all the pictures that you see. We bring in Native doctors, not all Ho-Chunk doctors, but from other Native nations across the United States. They bring their education, they bring their experiences, they bring their life stories. That, what you see right there, is Dr. Iris Prettypaint. She comes to us from the state of Washington. And every year for the last 3 years, she's been with us to share her knowledge about what we do. Who's more impactful than a youth than a Native doctor or somebody who understands who they are? And so a lot of this was what we do in deciding that we would bring along all of these people. Two things stuck out in my mind as we started doing this work. It was a comment from a youth, and it was a comment from an elder. The comment from the youth was, why are they putting all this money into programs for adults? Why are they not putting all this money into programs for youth? The adults already made their choice. They're already deciding what to do with their lives. What about us? That stuck out in my mind. The other comment came from an elder, and what she said was, can I say something? I said, yeah, you can. And so what she said was, I understand what you're talking about. I understand you're trying to develop a plan for your community to stop this suicide. She said, but one thing, she said, there's probably not going to be a plan that you have in black and white that's going to tell you exactly what to do when this happens to somebody that you know. And so what she said after that really hit home with a lot of us. And we thought about it, and we have to just do us. In every one of the communities that you guys are from, you know the strengths of that community. You know the weaknesses of that community. And so what we did was we brought together all the people that we could, and it wasn't just me. I'm just a spokesperson today. There was a lot of work that was done by our community. And so that community building that we sometimes forget about, I have this to do, I have to go to work, I have to take care of my family, I. It's not we, it's not us, but that's what it has to be. It has to be that bigger picture of who we are and supporting one another. And so along the way then, we broke down the barriers, and the youth themselves had identified 5 major precursors to why someone their age would want to do this to themselves. They came up with bullying. They came up with identity, lack of leadership, AODA, drugs and alcohol. And they also came, one I always forget, is domestic abuse. We had them put up these big sheets of paper and list what about these topics. And the one that was filled up the most, and sorry, I might cry, I hope I don't, but the one that was filled up the most was domestic abuse. Native nations go through a lot. A lot of people go through that. And that was one of their main reasons why they would want to not be here. And so we took these 5 topics and we addressed, and we got speakers, and we had activities built around these 5 topics because they were the ones who identified it. So a lot of the work that we do is youth-led, adult-guided. That's what it's become. So how are we going to know what to provide for you as young people if you don't tell us what you need? Yeah, we can design programs all day. But if we never get their input, how do we know that we're ever going to impact them? And so that's what we do, and that's what you see on the screen up there. You see a lot of dancing. You see a lot of circles. And one of the things that we always start with as Native people is a prayer. We never forget that. Sometimes we do, but we never forget that. That was the main reason how we started, was with prayer. And then we feel like that's gotten us a long way because we continue to do that. And so we infuse that spirituality that we have within ourselves, and we use that to help the young people cope with what's happening today. I like that somebody brought up coping skills. A lot of what you see is coping, the dancing, the singing. Where are they going to find their identity in what they do? Will they find it out in a public school in Wisconsin? How many of your public schools have this, what you see on this screen? Anybody? Mm-mm. So we had to have them provide it. We help them along the way. You'll see a fire in a lot of the pictures. And then we also burn cedar, tobacco, and sage, depending on your belief. A lot of what was burned here was cedar. That's the way that our area believed. And so that's what we did. One of the main things that we feel is coming about a little bit better is the elder panel. So fusing that gap between the youth and the elders. We know there's a great big gap in there. How many of you sit down on a regular basis with your grandparents? First of all, how many of you have grandparents yet? And so we try to bridge that gap in there, and we have the youth, we have them ask questions of, of the elders, but they kind of do it in private so that they're not, so that they maybe feel like they might offend one of the elders or be disrespectful by what they're asking. And so this year's panel, we had questions that the youth asked. They put them down on index cards, and then we kept track of them. I want to read some of these questions to you because this is what our Native youth think. What should you do when you feel like you have no one to talk to, even friends and family you trust? How should you approach it when you are uncomfortable with one of your parents' relationships, like a step parent, but you want your mom or dad to be happy? How do I keep away from drugs and alcohol? How do you talk about identity and suicide? And how can I be okay with it? How does one deal with grief? We also know that grief is very powerful, and that grief can take you down just like that. So they're asking this. Another question is, do you feel like bullying has been getting worse since you were younger? Also, do you think you were taught to ignore bullying or fight back in your younger day? If so, do you feel like it worked or didn't work? How do you deal with racial discrimination at school? Still exists. How does substance abuse affect families? What is one way that elders are getting involved with their youth in the culture? How do people cope with bullying other than suicide? What is one of the biggest morals or lessons you've learned throughout your life that you find most important to live a healthy lifestyle? So would they have asked questions like this out in front of their peers? Had they been in front of their peers? Right, no. So we're getting some really interesting questions that they have, and some of those questions were answered, but we find that that needs to be a bigger part of what we do because they need those connections with their older people, not only for the history, but for that identity. And that was one of the things that they had identified. Identity. Who am I? Where do I come from? What do I do? By the way I dress, you might be able to tell what clan I am, even what tribe I'm from. And some of them don't know that. And so through the conference, we tried to do that. We had a number of not only babies in strollers, but elders at our walk run. So we also try to infuse that healthy part of what you are, who you are. So it's not just in the mind, it's also in the body and the things that you have to get moving to make yourself feel healthy. And that's why the youth decided to do the walk run in our community instead of going to the Fox Cities Marathon. So that was one of the really big things. And again, they were the major planners of this particular conference. This particular conference brought in over 12 different tribes, not just from Wisconsin. Wisconsin has 12 tribes of its own, but they were also from Arizona, and we also had some relatives from Canada come in. They wanted to see the work that we do. This is our third conference that we did right in our community. We've always been at the conference center. So that has a whole totally different atmosphere than if you're right in our community around a fire and in our own facilities, you know. So it was very, very amazing to see this many young people come. One of the interesting things about this year's conference was that the amount of females to males almost evened up. This is the first time since we've been doing this work that more of the young males have come over to take part of this. And so we felt very good about that because you all heard the statistics. You all know what's out there. So our young males are taking part of what's happening here, and they're speaking out, and they're saying that. They're provided a floor, an opportunity that they're comfortable with, and so they're able to come over and speak to us about what they need, about what they want. And so it was really cool. We had a contest one day. All the males stand up. Let's do it right now. All the males in this room, stand up. Literally, stand up. Okay? All the females. Who wins, right? Who always wins, right? So this is what happened, but it was reversed. We had more males, more young men standing up that time than we did young women. To me, that was amazing. I have a son, I have brothers. I have a brother who continuously does this, who continuously not only contemplates, but he attempts. What do we do? What do we do to help them? We have to try almost everything we can, everything that we know, but especially be ourselves. Revert back to those ways that you have, to those beliefs that your family's instilled in you. And that's what we try to provide here for our young people. There's not gobs and gobs of money that we ask for from the Ho-Chunk Nation. A lot of what happens at this conference, money is raised by the youth themselves. So we're not out there writing for tons and tons of grants to get all this. The community also helps with fundraising too. They can make quilts. They can do all the things that they have within their power to do to give money, to raise money. One lady, she cuts hair. She said, I'm giving haircuts free all day. She raised over $100, gave it to the conference. That's the kind of effort. That's the kind of work that we do. The people that you see right there, Haudenosaunee people, they came over and they shared their culture with us. They're dancing. Very vibrant, very upbeat. Very awesome. I don't know how many of these youth would have had that opportunity This conference that we do is open to the public. Anyone can attend, and it's free. It's free because we don't want that barrier in there of you to not bring your young people over, of you to not come over and see exactly what we're doing. So if you hear, it's probably going to be in September again. We'll get it to Sam or whoever wants it. Come over and check us out. Come over and get in one of the dance. Let's break down those barriers. You know, that money, wherever that money sits, in a square, in a triangle, wherever, whatever county, whatever state, or whatever city that money is sitting in, that you can only serve those people in there. That would be my suggestion to people here listening to me. Break down those barriers. Invite everybody. It's about all of us. Not one of us can do it together. Thank you.
Well, thank you so much, Lanette, for those words, and giving us a little physical activity today, getting us up out of our seats. So thanks so much. Thanks also to Danielle Yancey, Melissa Matox, and Lauren Cornelius from the Native American Center for Health Professions at UW School of Medicine and Public Health, who helped make this connection to Lanette. So thanks.